The only problem with giving at below 1 year is that because the child usually would have some immunoglobulin, some antibodies, some defense substances that the child acquired from the mother, that can neutralize the vaccines if given below 1 year,
okay.
Especially if it's given very close to, because some people are even recommending it to be given at 6 months, because sometimes we see children that are, before they turn 9 months, they will even have measles. So it's very important in endemic environment to give it very early, before 12 months.
Okay.
But once you give that, it is important to note that that child should get another dose of measles vaccine after 1 year.
Aha. This is where I was coming to. This second dose, is it necessary for every child, or just the ones who received it early in life?
The second dose, because the first dose of measles vaccine will give about 87% coverage.
Okay.
So getting actually 2 extra doses will give almost 100%. So it's recommended that people get at least 3 doses, actually.
Okay. In your experience, do you actually see children who come for more than 1 dose of the measles vaccine?
Yes. The only problem is that in most, because it depends on our national program on immunization, is very important for countries. That's one of the recommendations of the World Health Organization, that countries must include more than 1 dose of measles vaccine in their routine immunization. So because parents would have to pay for the extra vaccines, a large number of them won't come.
Or perhaps because they just don't know.
The issue is in Nigeria is a lot of our people are poor, and measles itself affects mostly the poor people. So I think finance is very important here, because a lot of them will come at 9 months to get the vaccine. And then you also notice that when they are coming for the routine immunizations, the ones they would have to pay for, they don't want to take
those
them.
ones.
Yeah. So I think the affordability is very important. So it's high time Nigeria included some of these extra vaccines, especially because, like this year in January, there was an outbreak in Lagos,
yes,
where about 20 people died. In about February, there was another one in Sokoto State where about 23 people died. And then in about, I think 2012 in Katsina State, there was an outbreak where about 198 people died.
That's a lot.
So it's very important that we look at the coverage in the country, because it varies from one part of the country to the other, especially where you're having insecurity in some areas, parts of the country. So there should be political will, especially because measles has so many other possible complications. And then
let's not go into the complications just yet, but how is measles spread?
Measles is spread by droplets, by aerosol, the particles in the air. What happens is that when someone who has measles comes into a place and probably sneezes or coughs, he would spray some of the particles that are airborne. And in fact, face-to-face contact is not important. The particles will be in the air up to 1 hour after the person had left the office or had left the hospital or had left your house.
And they will be viable.
Yeah, they will be infectious. Yeah, they will be. So, and then when you inhale them, it goes through the airway. The linings in the airway gets into the body. It can also enter the body through the conjunctiva, the lining of the eyes. So it's very important that a lot of personal hygiene and sanitation.
Well, that means that nobody can be too careful. You wash your hands, but you breathed in, and it might have gone down your throat. Or
exactly.
Whatever.
That's why vaccination is key. Even in the like 100 years ago, before they discovered the vaccine, it used to be said that every child is entitled to measles infection before the age of 15. So it was difficult to avoid measles. But the measles vaccine is almost 100% effective. So once we can get that and give our people access to that, we'll expect everybody to be protected.
This rash that you said usually children come down with when they have measles, is there anything specific about it, anything special, different about it, that one can just look at and understand?
Yes. The important thing is that sometimes the confusion may just be, is it a drug reaction or is it, what kind of rash
Yes,
is this?
because rashes come all the time, you know.
So for instance, your child may be having fever and then you get antibiotic or you get given anti-malarial and then the child breaks out a rash. So, but the characteristic thing about the measles rash is described as maculopapular. Macula is like a map. It's just an area of circumscribed discoloration. It may be dark, it may be reddish, it may be any color, but you see those areas of discoloration. And then you have papular, means just like pimples. So you see the ones that look like pimples. If you're seeing vesicular rashes, it's not like some rashes that will contain water. It's not likely to be measles.
So it's not a watery rash.
Yeah. So it's rashes that look like they are pimples, and then you see some areas of changes. Another thing particular about the rash in measles is the distribution. It usually will start around the hairline, around the face, head, and neck, and then begins to come down to involve the trunk, the arms, and the legs. Another thing is that it will get to involve every part of the body, typically.
Okay, so he'll be covered in a rash, literally.
And starting from the head down. And when it's disappearing, it also disappears in that pattern, the way it started.
Okay, now, when a person has measles, how do you treat? Is it a symptomatic thing? Like when the measles comes out, you just treat what you see, or is there medicine for it?
The treatment for measles mostly is supportive. Supportive means that the symptoms the patient is presenting with is a viral illness, and you expect that the virus will resolve on its own. So you give maybe fluids, then if the child is having fever, you give things to prevent, to reduce the fever. You can take a sponge, expose the child, okay? So there is no place for antibiotics here, except when there is some secondary bacterial infection.
Okay.
But in a few cases, you may have to give, there's a drug, some antiviral agents that are in trial that may be used. But many of them, they don't have, it's not foolproof yet. They haven't had a lot of very reliable control trials that will support that. Ribavirin, for instance.
Okay,
but
let's quickly
immunoglobulins
take a break.
can also be used, but it has to be in a hospital.
Okay, we'll take a quick break here. Join us again at the other side of the break.